The number of Republican-led states passing restrictions on abortion and gender-affirming care, others are taking steps to strengthen their own laws in an effort to protect patients and providers. And one of those states is Colorado, whose governor signed a trio of new health care bills into law earlier this month, ensuring the state will continue to provide access to abortion and gender-affirming care while also serving as a safe haven to those from out of state.
So joining us now is the first openly transgender legislator in the Colorado General Assembly, State Representative Brianna Titone. Representative, thank you so much for joining us. Let's start with these three bills that the governor signed, one of which you were the prime sponsor. What is the goal here?
Yeah, so we passed three different laws in Colorado recently, all about abortion, and one particularly about gender-affirming care, Senate Bill 188. The bill that I was sponsoring is focused on creating a shield for Colorado. We want to make sure that the providers who are providing abortion and gender-affirming care have the ability to do that without any interference. And we want to make sure that the people coming to Colorado or someone who's here already can receive that care without having someone come after them as well. Because these states are trying to come outside of their borders into states that have these protected health care and try to stop them in whatever way that they can. And we don't want that to happen. We want people to come here to Colorado or to receive the care that they need here, because here in Colorado it's legally protected health care.
One of the criticisms of these new laws, and the one you were particularly talking about, is that people will travel to Colorado to get care that's illegal in their home state. Are you at all concerned that that's going to put Colorado in a legal fight with some of these other states?
Well, the Constitution protects us as a state to have our own sovereignty in laws that we want to set up here and create. I mean, we have legal marijuana here. There's a lot of states that don't have that. So I don't see a problem where we can provide some services to people, whether they come here to smoke pot or to have an abortion or get gender-affirming care. All of that is protected by the Constitution, and we're going to stand behind that because the Constitution is the founding document that we abide by, and we have the right of a state to actually do that.
Representative, one of the issues that divides many liberals in this country is sports when it comes to transgender women in sports. The majority of Americans have been pretty consistent in the polls over the last several years that trans women shouldn't compete in women's sports. How do you ensure fair competition here?
Well, none of the bills that we've passed recently address that. We did have a bill in Colorado that was trying to set up some prevention of trans people participating in sports, but where's the problem? What is the problem we're trying to solve? We're not seeing a rampant number of trans people getting into sports and dominating in sports.
One of the major concerns with the health care, and that makes this such a hot button issue, is that much of this fight centers around children. Both sides seem to be pushing governments to make some decisions and to write some laws. Why do you think any of this needs to be legislated?
Well, healthcare really shouldn't be legislated. Whatever the needs of the patient, with parents and doctors in consultation with each other, with that consent, that shouldn't be legislated. That's medical science. When it comes to gender-affirming care, 29 different medical associations agree that gender-affirming care is actually good care that helps kids get through the depression of gender dysphoria. There's a big amount of fear that really goes into what gender-affirming care actually is and what it's not.
There aren't many trans lawmakers in this country, so you obviously have a unique perspective. Do you think there should be room for compromise here?
You know, it should be the medical providers who really are going to dictate how we do this kind of stuff. You know, a ban on anything is too extreme. You know, that should not be on the table.
This is an ongoing discussion that we're having all across the country, and I'm sure we'll continue to have. Thank you so much, Representative Brianna Titone.
Thank you so much.
Well, hey. Hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.